we could pull up the next video, please.
I said, I feel like I have it and no one else does. But
we're so nervous that we're making paper airplanes. See if we can remember how to make them. Woo!
Hello.
hi there, how are you?
Good, how are you?
Not too bad. Can you see me?
Okay. I'm happy to let you know that you do not have honey.
Oh my god!
Really?
Yes, you had a normal repeat number and both copies of the gene.
Okay.
You had 17 and 22 repeats, which are both well within normal.
Okay.
So I don't expect you to develop symptoms.
Okay.
I know it's hard when you have 3 brothers with this, 4 brothers with this.
Yeah, it's not easy.
It's not easy. And I know there's always some survivor's guilt there, right?
Yeah.
Because you still have people close to you that you have to watch suffer, you know.
Okay, so in this video for our questions, we're going to talk about testing options, symptoms, and survivor's guilt. So the first question is, what are some different testing options and what are some important tasks to complete prior? And we can start with Erica.
So now there are quite a few. You have your centers of excellence. So you have those that are HDSA centers that will provide a certain testing policy that they have in place that you can go to your local center of excellence to do. We also have at HD Reach an anonymous testing program that is a saliva. And then we have a therapy path with Dr. Bonnie. So you have a therapy visit by telehealth and then a psychiatric assessment. And then we go to the saliva kit. HD Genetics is another company that just came about within the past year that uses saliva kit as well. So you're starting to, before it is a blood draw in a lot of the centers of excellence, where some of them are moving away as far as organizations. And now some are doing saliva testing as things have just improved technology wise. And so all of this to say that not one thing is right for everyone. It's going to be your own journey and your own decision, and what's right for you may not be right for the next person. So it is educating yourself in the different ways of how you can test, of how you want to be tested, and how you want to be supported, whether it is in a clinic and getting that physical support, whether it's by telehealth, whether it's by saliva. You have different options now, whether you don't want to open up a medical chart at a center of excellence. Is there an anonymous option where you either have a shadow chart or you have a pseudonym so that you're not connected to that result? There are a couple of those options nowadays.
There's 2 things that I really want to bring up well before there's actually the testing that is done. So those were excellent points that Erica had brought up. A couple things. Number one, in this video, obviously this information was shared with, it looked like a significant other. I'm making an assumption here, but I think that's really important. And we talk about this, that when someone does this, it is a personal decision and it is their own journey, but it really is important to start thinking about your support system and who you want to go on that journey. Because a lot of times I do work with people over this past 25, almost 30 years of people who've said, I did this on my own. I figured I would talk to some people afterwards, and then they're carrying around this burden for many years, sometimes decades. So I think it really is important to start thinking about your support systems and say, hey, I'm thinking about being tested. What part of my journey do you want to be on or do you not? Because then I take the burden off of me and I put the control back on other people to say, yeah, of course I want to be part of this. Or, you know what, I don't know if I can handle this. So, the best of your ability, please don't tell me or don't include me, which would be okay, because that's about expectation. So I think it's number one, really trying to find out who the support people are who are going to go on with you to this journey. The second is that there are lots of checklists in terms of what can I do to look into benefits beforehand? Can I look into having long-term care insurance? We just talked about being in a facility, and are there things that people can do to protect themselves before by getting on benefits? HDSA has a wonderful person, Allison Bartlett, who is an attorney who specializes in disability types of law and can give people information. HDO has an incredible checklist that we offer to people that you can just download to say, what are all the things that I have to think about? Because I know that for people, I get a lot of calls that say, I'm ready, I want to do it right now. And then the first thing I do is say, it takes a lot of courage to do that, but I'm going to slow you down. And I want you to think about all these things that you might not have thought about. And the reason I'm doing that is because once you start this process, there might be things that you're not eligible for. There might be things that you haven't thought about. So really do take a look at some of these checklists and see if you can go through them, because they might spark some things of, oh, I never thought about that. So I think that's really important to do prior to actually going and getting tested.
Yeah, I completely agree with what everything has been said so far. And one thing that Erica started off with was talking about the different organizations. And I think what's really important is that to recognize that anybody who can order a lab test can order the test for Huntington's disease. Don't just go to anybody. Go to somebody who knows about Huntington's disease. This is where I've seen the most disasters, is where patients go to their primary care provider and say, I want to get tested for Huntington's disease. And the primary care doctor says, oh, okay, no problem. We'll just order this. And there's been no thought in advance. What are the repercussions? Making sure that there are support people that want to be involved are involved. And it just can have major downstream consequences if you don't go to a place that knows about Huntington's disease. So do start with a provider, whoever that might be, who is familiar with Huntington's disease and the process and the implications either way. But I think people have been thinking about this for a very long time, and they should not carry the burden by themselves, as Bonnie said. And asking people if they want to be involved or not is important. I've had family members get upset because they haven't been involved. They didn't know. All of a sudden, the person that I was testing found out that, or the person that my patient went to their father, for example, and said, I got tested. And the father got upset. Why didn't you involve me in the process? I would have paid for this. I wanted to be involved. I wanted to be there. So I think not including people can have consequences just as much as including people in the process. And that's something to think about too.
Yeah. And I will add that HDRH and HD Genetics, we have a monthly testing chat that we started. You can hop on, it's a DoxyMe app. It's the first Wednesday of the month from 4 to 5 Eastern time. And you can come on with a fake name. You can come on without, your camera turned off. Like, you can come on how you want to come on and ask questions about testing and take that time. And we pop on there from HD Genetics and HDRH. We're on there to go, okay, let's talk about this. Let's talk about this together. And let's talk about what types of things you should be thinking about. Let's take a pause, and then let's see what you feel your best options are for yourself.
In the video, he states that he feels like he already has HD. When in clinic, how common is it for someone to think they actually already have symptoms of HD? And you as a clinician, so Sam, you feel like you may even see some symptoms, because in the video, he looks like he has symptoms when they actually end up testing negative. So how common is that, Sam?
I think it's human nature, right? We don't see a tiger in the forest and assume that it's a house cat that we can go up and pet. And so it's human nature to assume that there's danger around us. And this is the modern equivalent of that, right? So here's this test, here's this disease, here's this idea that's coming at us. We just have to assume the worst. We have to prepare for something that's going to harm us. And so I think that's really only human nature to be able to make that assumption and go down that path. There are lots of reasons why people may have extra twitchy type of movements, whether it's too much coffee, or they're nervous, or there's a medication effect. There's lots of different reasons. And I think that there are certain signs, certainly on the neurological exam, that really only happen in Huntington's disease. And when we see that, I do get a little bit more suspicious. But if people are dropping things or knocking things over, or they note some twitching, really things that are actually quite common, not specific to Huntington's disease, people do assume the worst. And I think that's only natural. And in those cases, there's nothing that I'm going to be able to do to convince that person unless we get the genetic test, right? And show them and let them know for sure that they do not carry a CAG expansion.
When people are going to put themselves under the microscope, it happens all the time. So when I talk to families and somebody says, I do all these things, I forget a kid's name, or I trip, or I have some difficulties with other things. And I say, tell me about your significant other. Do they do that? Oh yeah, if there's been a time that they've had a temper outburst or forgot someone's name or tripped. Do you think that they have Huntington's disease? And not to be tongue in cheek, but just to say, this is what happens as we are stressed out, as we are multitasking, as we're getting older. These are common things, but people who are at risk or who are gene positive, not yet symptomatic, are always putting themselves under the microscope. So I think it's really important to at least acknowledge that with people. And exactly what Dr. Frank said, what Sam said, is that people will come in and say, if I can convince myself that I'm positive, when I get this news, it's not going to be upsetting. But if I get the news that I'm negative, it's like the icing on the cake type of thing. So they're always preparing for the worst kind of thing, because that is that human nature. So I ask that question of everybody who I do this genetic type of counseling. I'm not a genetic counselor, but is part of my role in my clinic. And I will say to people, do you think you've inherited this gene? And as Sam said, 9 out of 10 times, 99% of the time, people will say, I do think I have. And they'll list the reasons, and they'll understand in their head why that might be silly or that might not be reasonable. But I think it is this coping mechanism that people do have.
Yeah, and I'm going to get a little personal here. Like I met my fiance within this HD community, so they are gene negative. And with their story, they are clumsy. They do drop things. They forget things. There's a lot of things that happen. And they're like, if I didn't test gene negative, I swear this would be my HD. And it's their fake HD. It's tongue in cheek, but these are very human things. And when HD is a part of your life, you educate yourself further. Sometimes there's just nothing that's really going to make you feel better until you get that result. And still, even a negative result, that's still like talking about survivor's guilt next, like that still doesn't make you feel good. But you hone in on what the symptoms of HD are, and your brain and your mind is a powerful thing. And you can have very real experiences, physical experiences, because that's what you're telling yourself you're having.
Absolutely. I tested gene negative in the weeks between the blood draw and my results. I don't know how many times I tripped, fell, lost things, had emotional breakdowns. Yeah, I'm heightened anxiety and stress and emotions. It just intensified all of that for me. And then I broke down thinking that's it. I'm for sure now. I am now for sure. It's just something like the mind plays tricks on you. It really does when you're under that type of emotional stress, for sure.
I'll change that around to say your mind is trying to protect you, actually, right?
No, I think you're right.
Yeah, your mind is trying to, as Sam said, it's a fight or flight kind of thing. And your mind's like, just what's this Huntington's disease? Let's get into this so that when you get this information, you have this extra layer of protection. So I think just trying to reframe it to say, this is just my mind trying to protect me. I need to find out this information. And you did. You wanted to find out that information. Some people will live at 50% being at risk, even though they feel that they have these symptoms, and that's okay.
The doctor mentions survivor's guilt here, that he has multiple siblings that are still at risk. What are some good strategies or resources to help individuals manage this? And Bonnie, you want to kick this one off?
This is so real. And I know I have an article in me called Why Am I Not Over the Moon? Because I've worked with so many people who have tested negative. And then when I go back, because I always follow up with them 2 weeks, a month after, and talk to them, it's like, why am I not over the moon? And this has been told to me so many times. So first of all, it's real. This survivor's guilt is real. A gentleman that I worked with, basically after I went back to him and said, how are you? And he said, I'm more depressed than I have been. And I asked, and he said, if I was positive, I was going to leave my job that I didn't like, and I was going to go do X, Y, or Z that I love. But he said, but I'm negative. So he felt like he had to stay in this position. He felt more depressed. So he was giving himself a buy if he was positive, to go and enjoy life and do other things. And now that he's negative, he feels like he's stuck and in this rut, and then has to do even more for himself. So the first thing is to know that this is real, that this testing negative and why am I not over the moon, or the survival guilt of, even though I know in my head that my result does not impact the result of a sibling. Everyone has a 50% chance of being at risk, but then there's this feeling of, did I get through, and then my loved one, my siblings are going to be positive, even though people know that chance has no memory, but they feel, is this going to be then, if I have siblings that are positive, is it going to be up to me to take care of them? Or is it going to be up to me as the only person who's negative to take care of my mother, my grandmother, whoever it is? So I think acknowledging this, talking to other people who are negative, because there's this feeling of, I'm no longer in the club, right? Now that I'm negative, it's kind of, oh, you don't get it. So I think talking to other people, and if need be, getting therapy and getting support, I think that's really important to acknowledge, because we forget about this population. We're like, oh, everyone should celebrate. Yes, of course you should, but there are still some strong emotions that happen that need to be processed.
And they're still involved in a family that's impacted by HD. And so their responsibilities before they had tested yesterday are the same as what they're going to be tomorrow. People don't change overnight. And so if they were caring for a parent or a sibling, those responsibilities are not going to change. And HD is still going to be part of their life. They're still part of the club, unfortunately. And I totally agree with you, Bonnie. There's so many people that say, if I'm positive, I'm going to quit this job that I hate. And I stop them and I usually say, why don't you quit the job regardless? And usually there's an aha moment in there that it doesn't have to be tied to their genetic test, positive or negative. It is something that we should all do, that we should maximize our time on this earth, no matter how long it is.
And I will also add that sometimes there's that, you have that survivor's guilt, like you feel like you are like that parent. And that's with my fiance, that you feel like you are everything like that parent. You look like that parent. You're going to be just like that parent. And that becomes your identity almost. And receiving a negative result that was my last strand. That was my last connection to my parent that has deceased or is going to die from this disease. And there is rebuilding after. And so it's not going to be overnight. It's not going to just go away. Everything that Dr. Bonnie and Dr. Frank has said, it's going to be a process. Connect with the community, connect with other people who are going through the same things, and know that you are still so important. You're the continued advocates. You're the continued head of Help for HD. You're the continued different members that are caring for all of these loved ones who can't help what they're going through. And maybe it's just you completely disconnect and you live your life. That is so important, and that's what's needed. Yeah. Therapy.
Yes. Thank you, Erica.